How is HPV transmitted between sexual partners? Have you ever wondered how human papillomavirus, commonly known as HPV, spreads between sexual partners? Understanding this can help in taking precautions. HPV is mainly transmitted through direct skin-to-skin contact during sexual activities. This includes vaginal, anal, and oral sex. It is important to note that HPV can be passed even when an infected person shows no visible symptoms or warts. The virus targets the epithelial cells of the skin and mucous membranes, making areas like the genital region, anus, mouth, and throat vulnerable to infection. One key point to remember is that HPV is transmitted through skin-to-skin contact rather than through bodily fluids like blood or semen. This means that the virus can spread even without penetrative sex. For example, genital touching or oral genital contact can still result in transmission. Many people who have HPV do not exhibit any symptoms or visible warts, which is known as asymptomatic spread. This makes it possible for individuals to unknowingly transmit the virus to their partners. Additionally, HPV can be transmitted through oral sex, which can lead to infections in the mouth and throat. Some of these infections have been linked to certain types of head and neck cancers. The risk of HPV transmission increases with having multiple sexual partners or if a partner has multiple partners. While using condoms or dental dams during sexual activity can lower the chances of transmission, it is important to know that these barriers do not completely eliminate the risk. This is because HPV can infect areas that are not covered by condoms. Vaccination is an effective way to protect against the most common high-risk HPV types that can cause cancers and genital warts. Getting vaccinated can significantly reduce the risk of transmission. In summary, HPV spreads mainly through intimate skin contact during various sexual activities. Since many infected individuals do not show symptoms, transmission can happen silently between partners. Practicing safe sex and getting vaccinated are essential steps to reduce the risk of HPV infection and its potential health consequences. Always consult with healthcare professionals for personalized advice and information.